Welcome. Welcome. I can't tell you how delighted I am truly to have you here. This, as I said at the beginning, for the people who were here when I first started a few minutes ago, this is really the culmination of 5 years of hard work and a dream that I had about helping people who also have cardiac disease, as I do, to be able to learn how to thrive with that disease. And it really started with just an idea. I'm a psychotherapist by profession. My area of expertise is in loss, and specifically traumatic loss and bereavement, and also helping people who are dealing with really significant life challenges, be able to navigate those challenges. I also work with anxiety and depression, but I had, prior to my own cardiac event, I had worked with a number of people who had illnesses and chronic illnesses, and sometimes short, traumas, and then oftentimes people who were having extended traumas over time. And so I really thought that this made me an expert in the field of how to navigate ongoing difficulties. There's nothing like experiencing your own difficulty to be able to understand how much you don't know. And I really became aware of the gaps in my own knowledge. And I became deeply committed to filling those gaps, both intellectually, from my own understanding point of view, academically. I actually went back to school and got a second graduate degree, and I'll talk a little bit about that in a minute. And also just in terms of experience itself. And so I decided about 5 years ago to do this really deep dive into the areas of resilience and optimal human functioning and all of these areas, and then to figure out very specifically how to apply it to people with chronic disease, and most especially people with inherited or any kind of cardiac disease, because that's an area that's near and dear to my own heart, no pun intended.